This is Hits 106, Nassau, the Bahamas. It's time for Your Lane with Coach Trishana.
Yeah, it's time to empower, educate, and encourage your women to motivate you through whatever you've been going through. We can talk about it. We ain't passing no judgment. So don't be ashamed. It's all the same. Stay in your lane. Your lane. It's whatever your real life looks like. Stay in your lane. Come out the dark and don't be ashamed. Your lane. Let's have a conversation on what we face every day. Tune into your lane talk show. It makes us feel good just to know we're not alone. No more being isolated and cast aside. I want you to come up and talk. Just don't be afraid of your heart. So don't be ashamed. It's all the same. Stay in your lane. Your lane. It's whatever your real life looks like. Stay in your lane. Come out the dark and don't be ashamed. Your lane. Let's have a conversation on what we face every day. It's Your Lane Talk Show with Coach Trishana.
Hello, and happy Sunday, everyone. Welcome to Your Lane with your coach, Trish Hannah. It is so wonderful to be in your company once again. I am totally loving the rain. This rain is a help to someone who's been praying for rain, but praying for some type of water today. Some animal was like, God, I'm thirsty. So he's like, sure, yep, there it is. I'm going to provide for you. Some farmer was like, hey, I need some more water. Come, let's make this happen. And God was like, here, I got you. Yeah, right? So for those who are tuning to the show for the very first time, Your Lane Talk Show was created to empower, educate, and encourage women of all ages. And for those who've been following me know that we have been doing phenomenal works here. It's been this month has been a year, as you know, and we just got shows that are like ready, like out the door, ready for you, planned. We good to go. Last week we did a show with Pastor Kevin L. Ewing. He was on board with us where he spoke about rebellious behavior in children. And of course, he dealt with the spiritual aspect and implications of that. Oh my goodness. If you want to know more about that show, go to YouTube now, Coach Trish Hannah, or well, after the show, because you know you need your information today, right? So go to Coach Trish Hannah, episode 53. It's called Rebellious Behavior in Children. With that, he spoke about, the root of why children behave in most cases, of course, because, yeah. So the root of why most children behave the way they do. And then he spoke about, the generational issues with us as parents as well. Sometimes we do some things and then, like they say, when the fathers eat the grapes, the sour grapes, the children's teeth are on edge. So sometimes we as parents, we do some things and then we wonder why we see these things developing in our children. Mm-hmm. Yes, of course, the rebellious could have been because of some of the things that you have done. Some of the things you have said in their presence. Okay, so more about that show. You watch it on YouTube whenever you have a moment. This month, of course, we honored women, we honored mothers, guardians, godparents, etc., aunties, neighbors who have children or have something to do with children, even teachers. All right. And in that, every Sunday was something. And this particular month, because we're ending it, this is our final Sunday in this month, I could not end this Sunday with at least talking about our children's health, right? Because we dealt with the spiritual, we dealt with the emotional, we dealt with all those other things, but we did not deal with the physical. And so that's why we have with us none other than Dr. Carlos Thomas, and I'm gonna introduce him in a bit. But I want you to know that if you have someone or know someone who is trying to conceive, who has a child, who just had a baby, whose child is presently ill, for whatever reason, call grandma. Because, sometimes grandma keep the kids when y'all go on your hot date nights. And sometimes you got to go back to work. And then summer come in, grandma need to know what's going on and how to go about doing it. Let grandma tune in today. All right. If you want to, you can go to the Star FM dial, Star 106.5 FM, where you can hear us audibly. Channel 976, where you can also hear us. Or if you want to see this handsome gentleman to my left live, you can go on to Your Lane Live Coaching Facebook page. All right, to be able to see us live in that. And with this particular page, of course, if you have questions, we are able to read them and answer them for you on the live. And guess what? I'm going to open the lines today as well. The number to call is 328-8163, 328-8164. 328-8164. Let's just stick with the 4. So 328-8164 is the number to call today if you have any questions for Dr. Thomas. And guess what? I want to do a giveaway today. I want to do a giveaway courtesy of the Perfume Bar. This gift basket is worth over $200. And I don't even have a reason to give it away. I just want to, you have to be a mother. You have to be a mother. And I would say with at least 2 children. If you are a mother, and then I have to make sure there's some proof now, okay? So if you are a mother with at least 2 young children, young enough to still see Dr. Thomas, I want you to give us a call before the end of the show. In fact, when we go and take a break, I'll ask you to call in, all right? So let you write down this number. I'm giving you enough time to write down the number, 328-8164. And you're going to be the second caller. And with that, you receive a $200 gift basket, courtesy of the Perfume Bar. Okay, all right. All right, so for those who are watching, y'all, please share the live, tag someone, tag a parent, tag a mommy, tag someone. Let's get this show up and rolling. Your Lane, episode 54, Managing Our Children's Health, is brought to you by Airborne Freight and Cargo Services, John's Shoe Store and Accessories, Your Lane Life Coaching, Bahama Odds and Ends Party Supplies, Listerine, distributed by Lowe's Wholesale, The Perfume Bar, and Dairy Queen. Listerine teams up with Lupus 242 in highlighting all lupus warriors. Hey, for the entire month of May, this is the final day, obviously. This week is the final week. They are letting you know that partial proceeds of every purple Listerine purchase will be donated to the Lupus 242 Foundation. Okay, purchase purple Listerine at any one of the Lowe's pharmacy locations, and you have an opportunity to help with those who are, experiencing lupus, whatever it is that you could do to help the foundation. Go ahead and make it happen. I love, and I've been saying this all month, I love the purple Listerine, especially the ones that does not have any alcohol in it. I absolutely love it. The last time we had a dentist on the show, she said that's the best one. I'm only telling you what she said. Okay. All right. So the purple Listerine is the best. I like it, and I recommend that you use it as well. And then, of course, when you're using it, try to get it this week. You'll be helping with a cause. All right. My predictions of emotions today for this episode are 95% serious aha moments, because we have a pediatrician in the house. We have Doc in the house. If Doc in the house, of course, you're going to learn some things. You're gonna be highly educated, but you may be able to have your own practice after you finish with listening to Dr. Thomas. And I would say 5% laughter. Peace and what is it he likes to say at the end? Peace and love. All right, for those who are clients of his, patients of his, y'all know what that is. All right, but I would say 5% laughter. I don't know how comical he would be on the show, but I know he could cool. Yeah, he can hang. All right, and 0% teardrops. Nobody crying today except the baby. And that's because you listen to the show and then you're trying to listen and balance the baby at the same time. All right, but if the baby got to cry, let the baby cry. Because the baby will, actually, I tell you this, because the baby knows Dr. Thomas' voice, turn up the radio a little bit louder so that he or she can hear Dr. Thomas's voice today. Let's start with our introductions. We have with us in studio Dr. Carlos Thomas. Dr. Thomas was born in Jamaica, where he retrieved his primary and secondary education. Graduated from UWI, that's the University of the West Indies, Medical School in Jamaica in 1991. That same year, he moved to the Bahamas for an internship. Dr. Thomas completed his internship at PMH in December of 1992 and later on worked as a senior house officer in the pediatric department until June of 1995. That same year, Dr. Thomas did his pediatric residency at Jackson Memorial Hospital, University of Miami, and neonatology fellowship at the same institution from 1998 to 2001. In 2001, Dr. Thomas returned to the Bahamas as a consult pediatrician and neonatologist at PMH. He is an associate lecturer at UWI Medical School Bahamas campus and also has his private pediatric practice at Pediatric Associates. Now, if you want to know their locations, I think one is on Collins Avenue and the other one is out west in, what do you call that plaza? The Caves Plaza.
Village.
Yeah, Caves Village Plaza. Dr. Thomas is happily married to the one and only Mrs. Loretta Thomas. Hello there. I hope
One
you're
and
tuning
only.
in. One and only. All right. And he is they are proud parents of 3 beautiful, smart children. Dr. Thomas enjoys family time. That is crucial. He enjoys choral singing. I can ask you some questions for that. And he loves cycling and golf. Welcome, Dr. Thomas, to Your Lane Talk Show.
Thank you very much. It's a pleasure being here to share some time with you and your audience.
Thank you so much. Thank you so much. So listen, just quick question. You say you enjoy choral singing. Does that mean that you can sing or you just enjoy singing along?
Actually, I do sing. I'm a baritone. I
Oh.
sang for several years with the Nassau Renaissance Singers.
Oh,
And when I moved back to the Bahamas after my training in the US, I eventually joined the Bel Canto Singers.
oh wow.
So I enjoy singing. I do.
Wow. Wow. Look at that, y'all. Our doctor can sing. Find out if your doctor cannot sing, then you need to switch. Okay. All right. Because you need to have a pediatrician that can sing. All right. Period. All right. So talk to us, Dr. Thomas. Thanks once again for having us. Talk to us about the importance of managing our children's health. And then you could go from anywhere because, of course, I want to stream from as much. We want to get as much information from you as possible. I know prior to the start of this show, you said that our children's health comes even before conception. Let's talk about that first.
Yeah. So we have to start at the beginning. It's important if you want to have a healthy child to ideally plan your pregnancy. So there are certain things you need to have in order, certain health things that will enhance your pregnancy and ensure increase your odds of a healthy baby. As you know, we have problems with chronic non-communicable diseases, one of which is diabetes. We have many women who are diabetic. And if you are diabetic and if you have uncontrolled blood sugar during the first trimester, that can impact on the development of your baby. So it's important to get on your prenatal vitamins. We know the importance of folic acid in helping to prevent what we call in medicine, so problems with the spine, the lower spine. And so those things are very important. So you want to be in good health, ideally before you get pregnant. And the next point I want to make, which is crucial, is that you must have prenatal care. Far too many of our women come to our hospitals to deliver with no prenatal care. That's a formula of a disaster. So there are 2 reasons or 2 groups of reasons why prenatal care is important. One is mother's health. You need to be in a state of health to have a healthy pregnancy and a healthy baby. For example, sometimes the placenta, the afterbirth, is on the lower part of the womb. We call that placenta previa. If that mother goes into labor and it's not known, she could have severe hemorrhage and could die. So it's very important that you have excellent care before. Also, the developing fetus, the developing baby, the body starts to develop very, very early within a matter of weeks of pregnancy. you have a heartbeat by 6-7 weeks of pregnancy.
Mhm.
And so it's not always immediately clear that what you do in the first few months can impact on the baby's health forever.
Right.
So I want to put in a plug for prenatal care. You have to see your doctor as soon as you think you're pregnant, as soon as you've missed your period. It's time to go see your doctor to start the
That's
process.
important. Now you do have some people who are pregnant and because they are
Irregular cycles.
their cycles are irregular, that they don't know they're pregnant or not. And in most cases, they haven't had the folic acid and all these other vitamins stuff. What normally happens under those situations?
Well, having folds on board enhances the having a normal neurotube, normal spine. Not all women, of course, who do not take full acid have babies with problems,
Right.
but it significantly increases. So the moment you find out you're pregnant or suspect you're pregnant, years, you ought to be in your pediatrician's office, your doctor's office every year thereafter,
Every year, at least once
even
a
when
year.
there are no vaccines.
Yeah.
Because sometimes folks think that you only go to the doctor when it's time
Forget
for
about it.
shots.
Yeah, that's something that I actually want to discuss, because just because your child is healthy or looks healthy doesn't mean that you shouldn't go and get a checkup, because you want to prevent whatever issues.
We call it preventive care,
Yes,
and that's how you know how
preventive
well
care.
your baby's growing, developing, and so you can address problems early.
So when children come to you outside of their annual visits, what are some of the common health issues that you see, especially among Bahamian citizens?
We see among children a lot of respiratory illnesses: cold, cough, flu, wheezing, ear infections, throat infections, sinus infections. We also see, and we just are coming out of a period of gastrointestinal illnesses. So stomach virus, as we loosely call it, vomiting, diarrhea, tummy ache, and so on. Those are the most common causes. Of course, fever is oftentimes one presenting symptom that drives parents to the doctor's office.
Right. Oh, Lord, thank you, Jesus. Them fever when they were babies, when from teething and stuff like that. Oh, they used to send me. They used to drive me off the wall, and I had 3 of them. So I can only imagine how parents with 4+ kids, they deal with all these various illnesses from their children, and the anxiety that comes along with it. So this is just a question that I wanted to know. Have you experienced any, I'm sure you have, parents that seem over anxious about their children?
Oh, yeah.
And how do you deal with that?
We have the full gamut. I mean, you have to understand as a pediatrician that, well, some parents are new.
Yeah.
And some of the ones who are anxious or overly anxious are not new. But as a pediatrician, my calling is to be able to communicate to my families, to allay their fears, to make them feel comfortable about what their position. So you get used to it. You have to be patient. You have to be understanding. And then you have to put yourself in the place of that parent who's not medically trained. So what may not be medically significant to me may cause great anxiety to a parent. And my job is just to be there for them. So
right. There's another thing is, how do you deal with a parent who thinks they know more or better or know their child, and you're dealing with them? Do you allow them? Obviously, they're the guardians or the parents. So do you allow them to make the decision, or you just say, okay, well, this is what I think you should do, and you're adamant about it? How do you deal with that? For instance, vaccines, because that's where we're going into that right now.
Yeah.
We're gliding into vaccines where I know someone personally who would tell the pediatrician, hey, I don't want you to give my kids any vaccine. You can
Mhm.
go and do the checkup, but no vaccine.
Well, I'll answer your first question. The first thing I want to say is that every doctor, every good doctor learns to listen to their patient.
Mhm.
So I may have my own ideas, but you know your son, daughter better than I do.
Mhm.
And if you say, Dr. Thomas, something is wrong with this boy, I need to pay attention and listen. The other part of your question is, how do you handle a parent who thinks they know more than you?
Mhm.
Some might know more than me, some have more experience. And so you have to listen. And one of the things you learn after medical school, which is the art of medicine, is how to communicate
Yeah.
and how to convince someone that what you're saying is in their child's best interest. I'll give you an example, which is off topic.
Yeah.
Every once in a while, I'll see someone drive up to, say, the hospital with a child on their lap,
Mhm.
which is obviously crazy. And so my approach always is to try and explain that this baby has so much great potential, and you're putting this baby at risk.
Yes.
So when you coin your discussion in a way where the parent knows that you have their child's best interest at
Yes.
heart,
Yes.
you have a better chance of getting through.
Yes.
Now there are some people you will not get through to. My approach to vaccines is I strongly recommend
Mhm.
vaccines.
Mhm.
I believe in vaccines. I believe they're safe and effective in decreasing diseases in our world. I mean, time and history has shown the impact of vaccines on many, many, many diseases in our world.
Mhm.
But at the same time, I respect a parent's right to choose. And so my role is to try my very best to communicate and never twist the arms of parents.
Right. I was eating. There were parents crying during my kids' swim meet yesterday, and I heard them talking about their son that was. Oh, I don't want to stop or prevent anyone from taking vaccines. So I'm just saying.
Sure.
They said that their child was wheezing more ever since they received whatever vaccine they had last. But they said it was due to the fact that they took the vaccine that their child wheezes more and they have more respiratory issues because of the vaccine. Now, how true you think that is, or you think
I'm not
that
aware of
plays a
any
factor?
relationship between vaccines and wheezing
Yeah.
or increase in respiratory illness. It is possible for you to have something happening after an event.
Right.
And naturally, you're going to say it must be the vaccines. I'm
Right.
not convinced that that's the case. However, there are some parents a few of them in my practice, who are anti-vaccine.
Mm-hmm.
Most of them, though, are genuine in their concern. And most of them, their questions are genuine. They want to know, is this safe? Can you convince me, Dr. Thomas,
Right.
that this foreign thing I'm introducing to my baby is in their best interest?
Mm-hmm.
And so that's my job, really, to be able to communicate that effectively. And then there's a large group or another group of mothers who want to just wait for the vaccines until the child is older.
Right.
Or they may have ideas. They want to not do what's routine. They want to spread them out.
Mm-hmm.
And after I've preached my sermon, I love people to make their decisions.
Mm-hmm.
So I have quite a variety of patients in the office. Most of them, I'll say more than 90%, will do the vaccines.
Mm-hmm.
There are about 10% of those who are either hesitant or have questions. And the doctor's responsibility is to communicate to their parents
Right.
effectively.
Right. So when the baby comes out of the hospital, you said at the first month.
We see the baby in a few days, no later than 1 week.
With the vaccine.
In some cases, we see the babies 3 or 4 days after birth, especially those who may have jaundice or who may have feeding issues.
Right.
The vaccines do not begin until 2 months.
2 months. Okay.
So the vaccine series, the first 3 sets of vaccines are the same. So you have the same set of vaccines at 2 months, and at 4 months, and at 6 months. We call those the primary series.
What are the vaccines within those series?
All right. So we have a vaccine that's called DTaP.
Mm-hmm.
Diphtheria is now a very rare disorder thanks to the use of vaccines, but it's caused by a bacteria. It's a very severe infection. We don't see that anymore.
Mm-hmm.
I think in my 32-year career, I may have seen 2 cases.
Mm-hmm.
Tetanus, we commonly call lockjaw. There's a vaccine against tetanus, and P is pertussis, which is the medical term for whooping cough.
Right.
There's a vaccine against hepatitis B. There's a vaccine against poliomyelitis
All of this is within that
at 2 months.
series. The
Correct.
series.
There's a vaccine against a bacteria called Haemophilus influenza type B. That germ used to be the number one cause of meningitis in children. And when I moved here in the early 90s, we saw quite a few patients who had meningitis. Since this vaccine has come about and has been widely used since 1997, even in the local clinics, we seldom see meningitis.
Right.
Then we have a vaccine that became available in the year 2000. It's called Prevnar. And that vaccine protects against a bacteria called pneumococcus. And pneumococcus can cause pneumonias, meningitis, ear infections. It's the leading cause of death in children due to severe bacterial infections. So that vaccine is now around. And I'm happy to say, as of 2012, I believe, became part of the routine vaccine series in the Bahamas. And then the most recent vaccine has been around now for 17 years, became available in 2006. And that's an oral vaccine. The child drinks that vaccine. And that is called rotavirus, RTA, rotavirus, which is the primary cause for gastrointestinal disorders. So those vaccines are given at 2, 4, 6 months. And let me say, the purpose of a vaccine cause your body to respond and make protein called antibodies. Antibodies are specific to certain diseases. So the vaccine actually mimics the infection in the sense that it causes your body to make some proteins, which will subsequently help you from future exposure.
Right.
So, for example, the chickenpox vaccine, some of my clients from some countries in Europe, they do not do the chickenpox vaccine. They actually prefer, it's the custom to have your child get chickenpox. Well, there are 2 ways to protect you from future chickenpox. One way is to get the vaccine, a little prick. The other way is to get an illness with fever and blisters and itching and misery.
I don't want that one.
So clearly. So those are the common vaccines that we do earlier on.
Right.
At 1 year, you give the first measles, mumps, rubella vaccine. Now, for a long time, measles was gone from the face of the earth. We are now seeing resurgence of measles in Europe and even in New York and other countries and other states in the US. And whenever vaccine rates go down, we start to see diseases coming back again.
Okay. So let's talk about the Ministry of Education's requirements for those who may be, who have preschoolers going into school, or those who may, just need normally when you transfer from a school to another school, regardless of what you've had or medical papers you've had from that previous school, they still want you to present their medical records and the things that they require, right?
Yes, that's correct.
And so what are some of the requirements from Ministry of Education for the preschoolers, and then for those who are like in primary and high school?
Well, the preschoolers would have had their primary series of vaccines at 2, 4, 6 months, a vaccine at 1 year and 15 months, and in some offices 18 months. So vaccine, your fluid vaccines until you're age 4 through 6. We commonly call the 5-year vaccine, but it's age 4 through 6. So the preschooler would have gotten all the vaccines up to 15 or 18 months.
Right.
The ones going to in the first grade would have gotten their 5-year vaccines. And then after that, the next set of vaccines are the ones you get between age 10 and 12. The only other caveat is that there's also available flu vaccines, influenza vaccines, which, as you know, are yearly vaccines.
Right.
So again, we strongly encourage your children and adults to get their flu shots during flu season.
Right. Okay. All right. So Dr. Thomas, we're going to take a little break. And after the break, we want to talk about nutrition.
Yes.
I think that's vital. All right. So let's take a break, y'all, and we will get back as soon as these messages are completed. Okay, so
from Victoria's Secret?
We are still live on Facebook.
Yes.
Right. We're on a break on the radio. Okay, to my Facebook audience, thank you so much for tuning in. If you have any questions, please go ahead and ask. The doc is in the building. Someone says those bell canto singers don't play either. Lovely voices. Go, Doc, go. Yes.
You are actually the first caller.
Oh, the first caller. They paying attention. I even forget. All right, so we're gonna do the third caller. We're gonna do the third. That's what I said initially, right?
Third caller.
Right, the third caller. 3288164, the third caller. I forgot, Dr. Thomas. I didn't. Thank you
good.
so much for tuning in. Yeah. So and then I do have some giveaways from Dairy Queen as well. So it's good. To get those giveaways out and going. All right, so we're gonna when we get back on, we're gonna talk about. Okay, someone says this is informative. You hear so many views on vaccines, you never know who to believe. Maybe we should finish a little bit more on vaccine and then go.
Sure.
Yeah, okay. Because I'm here like a little slanted. My kids have their vaccines, but they're not up to date, and that was intentional.
Okay.
And that's only because I've been hearing information about what it can do and the effects or the side effects.
Call right back.
So maybe when we get back on, we'll continue. Let's see what we could do to convince persons.
It's natural to think about side effects.
Yeah. Let them hold. When we get back on, I'll answer.
Yes, please hold the line.
With Coach Trish Hanna.
Welcome back. For those who are tuning in, we have with us in studio Dr. Carlos Thomas. He is a pediatrician. He's ready to answer all of our questions pertaining to our health, our children's health and development, and how we can manage that. At the beginning of the show, I had an opportunity to tell persons I'm going to do a giveaway. This giveaway is courtesy of the Perfume Bar. And the Perfume Bar donated and presented to us a $200 gift basket. And the requirements for this particular basket was, first of all, you have to be the third caller. And secondly, you have to have at least, how many kids I said? 2?
You said 2?
You have to have at least 2 children. 2 children. So let's see who we have on air.
Hi.
Hello, caller. Welcome to Your Lane Talk Show.
Hi, good day.
Hi. Who am I speaking to?
Man.
Sorry, say it again.
Quendira Man.
Quendira Nair. I gotta ask you, Quendira, are you a mother of? Well, first of all, how many kids do you have?
I have 3 kids.
3 kids. What are their ages?
Their age are 12, 4, and 2.
12, 4, and 2. Dr. Thomas, you know that similar to me? No, not quite. 12, 4, and 2. I have 11, 9, and 5. No, that's a big difference. All right. Mrs. Nairn. Miss Nairn, you are caller number 3. Thank you so much for calling into the show. How do you feel?
I feel great.
Oh, you should. You should feel great. When was the last time I put you on blast right now? When's the last time you had your kids check up?
My daughter just went for a checkup like 3 months ago.
3 months ago. That's a checkup or a well visit. That's a checkup or something that happened to her. Something was wrong.
She went for a regular checkup.
Regular checkup. Okay, good.
Very
Good. That's good. Good. All right, Ms. Nairn. So what you're gonna do is hold on for me. Our producer is gonna tell you how you're gonna retrieve your gift. Now tomorrow's a holiday, so we will catch up with you on Tuesday, God's willing. You will be able to collect it at the Nassau Guardian located in Oaksfield, because I can't really say we're opposite. All right. So once you give us your information after he's going to give you the information, right? I mean, you're going to give it. Okay. So you're going to give Beats the information and we will let you know how you'll retrieve it. Okay. Thank you so much for calling in and thank you for tuning in to Your Lane Talk Show.
Thank you.
Thank you too. Dr. Thomas. So what we were saying is that we were going to talk about nutrition, but the statement I got on Facebook, someone said, this information, this is very informative. You hear so many views on vaccines, you never know who to believe. And I think we need to touch a little bit more on that, just for those who may be on edge or unsure or uncertain if this is the right thing for their children, based on so many different side effects that we've been hearing, so to speak, other parents talk about.
Yeah, the first thing I'll say is when you are in doubt, it's best to listen to the experts.
Mhm.
If you want information about anything, you want to go to the experts, the people who do it all the time. That's one. And two, I think it's perfectly appropriate for parents to ask questions and ask difficult questions and raise points and share experiences. There are side effects of vaccines: pain, fever, irritation, and every once in a while you may have an adverse effects. And these are all reported. When I give vaccines, I have to write down the lot number and so on. So that if someone were to have a side effect, I have to report this
Right.
to our local ministry and so on. The benefits of vaccines by far outweigh the minor side effects. Vaccines are very, very important. And unfortunately, we do see patients who come in who are not having vaccines, and they're at risk themselves and at risk to pass on diseases to other patients. I'll give you an example. We hadn't seen measles in the Bahamas. The last case was 1997. In 2019, was that 23 years later, I saw a patient in my office, and the staff told me that he had measles. So I came down to see this patient. He was a visitor from France, not vaccinated against measles, and became very ill. And so in 2019, we had our first case since 1997. It's clear that patients who are vaccinated are much more protected than those who are not.
Right. And
so I welcome questions from parents. I think you ought to, if you're a parent, you should always ask questions and get clarification on the why should you vaccinate? What's the downside? What happens if I don't? What are the side effects? But vaccines are very safe and very important to our well-being. We are a healthier nation today because our parents and grandparents took their vaccines and gave us vaccines.
Right. All right. So let's talk nutrition. All right. So first of all, I always start with the light questions. How do you get your toddler to eat fruits? Like, how do you get the picky eaters to eat nutrition?
I'm going to answer that, but let's start at the beginning again. Let's start at the beginning. I want to put a plug in for breastfeeding.
Okay.
We talk about it a lot, and sometimes it becomes like a broken record, but there are many, many, many great reasons to breastfeed your baby. One is the ideal milk for babies. It's easy to assimilate, to digest. It has all the right proteins, carbohydrates, fats the baby needs for their growth, not just their physical growth, but for the brain development. It also helps their immune system. It confers on particularly their respiratory system and their intestinal system, great immunity. So babies who are breastfed have less respiratory illnesses, less gastrointestinal illnesses. There's less problems with obesity even later in life. It's great for bonding. It's ready-made. It doesn't cost you anything.
Yes.
It's ready. So breastfeed as long as you can. Aim to do at least 6 months if you can. Now, there are few women who have great struggles and who find it difficult and it doesn't happen. It's okay. But there's nothing better than breast milk.
Yeah. Sorry, I mean to cut you off. Do you help with milk supply for those who may? There
are things that they sell in the market.
Fenugreek
and those that I'm told enhances breast milk to be well hydrated, well rested, all of which are very hard when you have a young baby at home. And then we have lactation consultants. We have specialists who are trained in how to train a mother how to breastfeed. So if you're having challenges in the first few days and weeks, you want to inform your pediatrician, and I'm sure they can align you with one of our many lactation specialists. So don't give up. Don't give up.
Don't give up, even when it hurts. I don't know if some may not have that issue, but you have some mothers, including myself, where it was painful.
Well, I tell you something, Trish. Successful breastfeeding means your baby's getting adequate nutrition and you're having a wonderful time. If you're having severe pain, it means the latch, the way you're holding the baby is not ideal.
Incorrect. All right.
And that's where the lactation specialist comes in.
Right.
So you can have a pleasant experience while you nurse your child. You should not be in agony while your child benefits.
Yes.
The next thing I want to say is that the American Academy of Pediatrics and most pediatric societies across the world recommend that you start feeding solids at 6 months.
Mm.
When I say solids, I mean all the pureed,
Right.
non-milk options.
Mhm.
There's a lot of pressure brought to bear by grandparents to start feeding babies early, but we recommend at 6 months.
Mhm.
And one of the ways you can not ensure, but improve your child's chance of having a healthy appetite or balanced diet is when you start to introduce solids.
Right.
So many times parents are tempted to start with all the sweet things first. So they start with the banana and the mangoes
Mhm.
and the sweet potatoes and the applesauce. And if you do that long enough, your baby becomes accustomed to that
Yes.
nice sweet taste of sugar.
Yeah.
And then it's unlikely they're going to enjoy the vegetables. So in my practice, we ask our clients to start with the vegetables first and so on, and start with once a day and gradually work your way up.
Amazingly, that's what I did. I started off with the vegetables first before I introduced the fruits and anything sweet to my last born, because I call her the last button on Abraham's coat,
Mm.
right? I have no issues with my first and second child, but the last one, it's very difficult for her to eat fruits. Like, she will not. The only thing she would eat, surprisingly, are raisins. And I mean, that's the only thing. So what I do is I cut up things, like I put things in the pancakes,
conceal it,
and
yeah.
right, I put things in whatever it is that whatever she's eating. I make sure that she has the balanced, the vegetables and fruits in there, and make it appeasing for her. You know what I mean? But you have some toddlers who are just so picky that they're not getting
That's
sufficient
true.
nutrients.
That's true.
So
And
how do you deal with that?
there are two kinds of picky children. The less common group are those who eat quite a wide variety of things, but just small amounts.
Mhm.
But the more common is the child who just likes 3 or 4 things and wants the same thing all the time. So one of the ways you can help to improve that or make that better is to try to eat together as a family as far as possible.
Okay.
Mornings may not be easy, but certainly evenings you want to eat together, because children learn to eat what they see around them.
Mm-hmm.
If mom and dad are eating fast foods all the time, they're going to start doing that as well. So you have to model good behavior in front of your children.
Mm-hmm.
So try and eat together. I tell parents, when you have these 3-4-year-olds who refuse vegetables or who are picky eaters, you eat and you make the most interesting face and like it's the best thing you've ever had, and really put on an act, and they'll watch you.
Mm-hmm.
Because many parents will say to you, my child won't eat at home, but at school they eat, because of the positive peer pressure.
Right. Okay.
So
Somebody asked the same question that I asked about the picky eater. So I hope that they.
And then for those who are really very picky, so that's another reason why it's important to have your regular child's well visit.
Right.
So if some kids are picky, but they're growing well and they're thriving and they're happy and they're full of energy. Some kids are picky eaters and they're underweight, they're undernourished. They can have anemia. And so it's very important to have your doctor see your child regularly so they can intervene early.
What are your thoughts on supplements like Pediatrician?
Pediatrician is one of the things available to you as a supplement.
Right.
What you do not want to do is have your child become dependent on it.
Right.
I guarantee you, if you find 22, 3, 4-year-olds who drink or are picky eaters, most of them either drink too much milk or too much juice, and they become satisfied. So we encourage our parents to limit juice. We want our kids to be lovers of water,
yes,
and have juice occasionally, as opposed to the other way around.
Absolutely. I'm just trying to read over some of these questions here. Can you post them?
And so when you pack your snacks, when you pack snacks for your children, try and pack healthy snacks.
Yes.
We can't get away from what people fast food. Okay, I mean those are nice treats once in a while,
Once in a while.
but should not be the routine.
Right.
So fruits, pack fruits and vegetables, and you have to eat them at home. Though you have to practice that. Your child has to see mom and dad eating those things regularly. You have to see it around a lot. So raisins, grapes, you name it.
Right. So what I want you to get a little bit more detailed when you pack in, because we as parents, most of us, will pack the little snack, pack the cookies in there. Of course, you'll have a fruit. My 5-year-old bag, lunch bag, consists of Go-Gurt. I know it's just really sweet, but it's a yogurt. The raisins.
Yes.
She'll have what you call it, goldfish crackers, and maybe once in a while, like a sun chip or something like that, that's in her bag, along with water, because I don't give them juice throughout the day. So what are some other things that you could think of that are that has nutrients or nutritious for kids when they see their friends eating chips and the sweet Debbie pies?
So it's a great question. The part of the challenge is they're going to see the other things, and the salt and the sugar in these things are just so attractive to children, even to grown-ups. I like the fact you said you pack water. We're having a big problem locally with obesity, childhood obesity.
Yeah.
It's more serious than people think. And part of the reason is the amount of sugar in our drinks and snacks that we consume. So I like the fact you said your child gets more water and less juice.
Yeah.
You have to kind of make it interesting. I mean, a goldfish is okay. Raisins are fine. Grapes, bananas, apples, Cheerios. Balance is the key. And when you're 3 years old, you don't want to eat quote unquote healthy all the time.
Right.
So as long as you're getting a fair amount of protein and proper carbohydrates, not simple sugars, that's what's important.
Okay. So how do you deal with like meals, like healthy meals at home? I made a suggestion for those with picky eaters who don't like vegetables and stuff. I made my suggestion to say, okay, cut up the vegetables and try to, sometimes I will puree them, like the fruits, I'll puree them into different breakfast meals, like pancakes, etc., waffles. But what do you suggest for like meals that, for dinner time for children? They don't want the broccoli. They don't want the carrots. How do you deal with that?
Well, some parents become very, very good at concealing, like you just said, mincing, cutting up stuff so it's hidden. That's one. And then there are smoothies. Sometimes children find smoothies interesting. So you can do smoothies. You can put some kale, some broccoli, fruit. So there are many ways to get around it. It's not easy, but you have to keep trying. You have to keep modeling good behavior. I've said that so many times this evening, but it's important that children see that we do the things that we're asking them to do. We can't be having bad diets and tell our children to eat healthy. So you have to model good behavior.
And normally when we're traveling, there are not that many options at various restaurants for toddlers. They would have the macaroni and cheese, the chicken tenders and fries. That's it, mostly in most restaurants. So how what is it that you think that we can do for those who are going on vacation and traveling?
If you go to a restaurant, you're confined to what they offer, but that's when you can pack other things along.
You pack it and bring it.
And bring it along. Not necessarily to a restaurant,
no,
but other times. I had a thought so it'll come back. But it's very important to model good behavior in front of your kids. Yeah. Very, very important.
Yeah. Okay. So what else is there? We spoke about the vaccines. We spoke about, breastfeeding. We spoke about, the annual visits. What else can we possibly consider?
Exercise. Did that word come up yet?
Come
Exercise.
On. Let's go.
So part of the health visit is to check a child's weight and height.
Right.
And I said earlier, we're having an increasing problem with childhood obesity in our country. That's a big problem. It has many facets. One is the teasing, the bullying, and so on. But also, if your child is overweight, obese, if you don't turn things around, they're likely to become an obese adult.
Yes.
If you're obese as an adult, your risk for hypertension, diabetes, heart disease increases. So it's very important that you encourage good exercise. Now remember the thought: positive reinforcement. When your child has 2 P's, it's time to celebrate and make a big deal about it, right? You can have a point system. If you eat your vegetables, one vegetable every day for 2 weeks, you get A, B, C, D, E.
Wow.
So you can make it interesting.
Yes, I
exciting.
like that. I like that. That's a good
But
one.
exercise, kids have to move. When we were children, we ran around the yard.
Yes.
Some of us climbed trees, skip ropes, and so on.
Mhm.
And most of our children spend time on the sofa in their bedrooms
On
their
devices.
devices.
Yes.
And devices are here to stay, but we have to have a balance.
Yes.
We need to have our children moving. And so we have to set the examples as well.
Yes.
Just like walking, jumping, swimming. But we have to get our kids involved in physical activity on a regular basis.
At what point, when you see your patient, your children, then they come to you, that you would refer them to, this is off topic. I
Yes.
finished with nutrition. This just came into my mind just now. When you refer them to therapists, and the reason why I thought about that is because of the teasing. I have a church member that has a granddaughter that is obese, and she gets teased basically every single day, according to her grandma. And it's at a point where her self-esteem is just to the ground. Like she needs help. Now, at what point, even if some of a child is obese, do you recommend them going to see someone?
There's some happy obese children,
right?
But you raise a very, very important point, and that is the impact on obesity and other illnesses and conditions on children. So, as a doctor, I have to be I have to be aware of these things. I have to look out for these things. As part of our assessment, we ask questions about your level of happiness, your level of confidence, your self-esteem. And if you spend enough time with your patients and get to know them, you will know when something is off. So when do you refer them? When the parent recognizes that there's a problem, or in your interaction with that child, you can sense that they're not happy. They're not. You ask how many friends do you have? Who are your friends? What do you do at break time? Who do you hang with? And the child who's alone, who's by himself, poor affect, meaning their mood, poor eye contact, not smiling. Those are signs that there may be some problems. I remember a couple of years ago, I saw a young man who may have been about 16, who came to the office, and I didn't immediately recognize him. I had seen him for about 5 years. Only when I saw his mother, I knew he was, but he had terrible affect. He walked in, shoulders slumped, looked very sad. He also had very terrible acne. So he came to the visit along with his sister, who was maybe 5-6 years younger. When I asked her about her level of happiness and self-esteem and confidence, 10 out of 10, doc. When I asked him, he said, I don't have any friends. Nobody talks to me. So I turned to his sister and his mother and said to her, why don't you share some of your joy with your brother? Then she said, I don't talk to him. And I was very concerned for that young man. So I had to put mom aside, and she was being very harsh and organize some help for him. I'm happy to say when I saw him 6 months later, he was a different person.
I love that.
His acne had improved due to medical care, but his self-esteem had changed. So as a pediatrician, you get to see and interact with patients on a regular basis. You get to know the families. They start to have confidence in you, and they'll share things with you which ordinarily they wouldn't share with somebody else, because they trust and value your judgment and your opinion.
Right. So let's go back to the obese child. What are some of the recommendations that you give parents to help them to get onto the more healthier journey?
Well, we talk about diet and exercise. We explore the diet. Sometimes parents are very forthcoming with information. Sometimes you have to pull it out of them, because they may say, he doesn't eat much, doc.
Really?
And it's all relative, right? And quite often, an obese child has parents who are overweight as well.
Right.
So I said earlier, you have to model good behavior in front of your kids. If you're healthy and fit and exercising, your child is like to follow you. So there's the diet and there's the exercise. And in my office, patients who are obese, especially if they're significantly obese, I have them come in monthly for a weight check, and I have an incentive program. where I reward them when they lose weight.
Wow.
And I write down in the chart and they come back and then they lose 2 pounds and they're excited.
Excited. Yeah.
If you're 40 pounds overweight, it's going to take you quite a while to lose that. And so you have to reward the small successes, the 2 pounds that they've lost or the 1 pound that they've lost. And then sometimes we have to seek counseling. Sometimes the obesity is a symptom of a deeper problem, depression, for example. And so we have clinical psychologists. We have a couple of pediatric psychiatrists that we refer patients to when we suspect something's happening. And if you have a good rapport with your family, they won't be offended by your suggestion, or usually they won't be.
Yeah.
So that's very important.
Yeah. Yeah. Okay. So we got the exercise. Yeah. We got the exercise. We got the nutrition. We got the mental. We didn't talk much about the mental, right? So we're going to talk a little bit about the mental. Let's take a break real quick then. For those who are tuning in, we have some Dairy Queen cakes. All right. So let's see if we can do that. 3288164, 3288164. We have 2 gift certificates courtesy of Dairy Queen. You have to be a mommy. You can have 1 child, but you have to be a mommy. I think the last one I said 2 or more kids. Once you are a mother, and I don't mean a pet mom, of a human being. Oh, you should have heard the last show we had just now. We had a veterinarian on, and listen, persons who may not have conceived or had biological kids or human kids were pet mommies, and you couldn't tell them anything otherwise. Okay. I know. All right. So in this case, we're looking for a mother, whatever amount of kids, that's up to you. But I want you to call in 3288164. We have 2 gift certificates courtesy of Dairy Queen of some nice ice cream cakes. I know you love those, especially on a Sunday. All right. So tune in, call in 3288164. The first and the second caller, they're all yours.
This is your one-stop shop for all your footwear needs. Whatever the occasion, Johnson's confident you will find what
I'm
you're
not
looking
seeing
for.
some of the, I don't know if this is going through, but I'm not seeing some of that's the last thing that you got. The last input. I'm not seeing anything. Should I sign out and sign back? Oh, you get to see them. Okay, good. All right, because I don't get to see them. All right, to my Facebook audience, do you have any questions for Dr. Thomas? You can type them in. Let's go.
Ask Dr. Thomas when he thinks a child should start going to nursery or preschool.
That's a good question.
Especially if the parents expect the child.
All right, so can we answer that? That's a heavy question. Can we answer that after the break?
Sure.
Yeah. That's good. I love this commercial.
That was nice.
Yes. Wendy did this.
Oh. Okay, you got the first one. You're going to talk show with Coach Trish Hannah.
Party
You
often.
are the first caller. Can I get your name? Tammy. Okay, Tammy. Just 1 second.
Welcome back. If you're tuning in for the first time, we are live with Dr. Carlos Thomas. He is a pediatrician and he's answering all of our questions pertaining to our children's health. And just before we went on a break, I had an opportunity to give some Dairy Queen ice cream cakes out to the first and second mommy to call the show. And I think Beats is actually online with our first caller now. Let's get the first caller. Hello, welcome to Your Lane with Coach Trish. Hi. How are you? I'm not hearing her.
Can you hear me?
Yes, I can hear you now. Who am I speaking to?
Tommy.
Hi, Tommy. It's one of our listeners, so she's so dedicated. Thank you so much. Are you enjoying the show?
I am. This is very informative.
Excellent. Tell me something that you learned so far. I'm putting you on the spot.
I learned the before bed because my children said wanted snacks for bed.
You heard what she said?
Yes, eating more vegetables.
Eating more vegetables. And how many kids do you have?
I have 3 children.
3. What are their ages?
I have 18, 4, and 3 girls.
18, 4, and 3. That's a huge gap, Mom.
Yeah.
It's a huge gap. But guess what? Congratulations. You are our first caller to a ice cream cake courtesy of Dairy Queen. You can hold on for me so that we can get as much information from you so that we can ensure that you get that gift certificate from Dairy Queen courtesy of, I'm making sense? A gift certificate from Your Lane Talk Show courtesy of Dairy Queen. Thank you so much for calling and continue to tune in.
Thank you.
Congratulations. Doc, we had a question on our break.
Yes.
Beats, put your mic on so you can read it for me. Put on hold. Tommy, you're going to be on hold for just 1 second. Read the question for me quick, Beats.
All right. So the text comes in, and this listener wants to know what Dr. Thomas recommends for when he thinks that a child should start going. When he thinks that a child should start going to nursery, especially if the parent suspects the child may be on the spectrum.
Let me answer the first part of the question without the spectrum.
Right.
So the question is oftentimes asked, when should my child start going to preschool?
Mm-hmm.
And it has to do with several things. There are some parents who have to go back to work.
Mm-hmm.
There are some parents who don't have a grandma and aunt. So it's a necessity.
Mm-hmm.
And so there are nurseries that start from 6 months and more, and there's some preschools start at 18 months.
Mm-hmm.
So it's really a parental decision. Some children are ready to go and some are not. So it's a personal decision. The other part of the question, which I think the caller is probably more interested in, is when do you send your child to school if you suspect he or she's on the spectrum?
Mm-hmm.
And by spectrum, I think the caller means autism
Mm-hmm.
spectrum disorder. First thing is that we're seeing more autism now these days than we saw 10, 20, 30 years ago. And it's not just because of over-reporting. So some people think that maybe we now recognize it as an entity. And so maybe before we just said you're slow, that may just be a small part, but we're seeing more autistic kids.
Mm-hmm.
We're not quite sure what the cause is.
Dr. Thomas?
I mean, there are many speculations.
Yes.
It's clearly multifactorial, environmental, diet, genetics. It's a complex thing.
Mm.
Now, autism, as some of our callers may be aware, is a condition that affects the way your child develops in terms of their social skills and their language skills.
Mm-hmm.
So it's typically diagnosed after a year, typically after 18 months,
Mm-hmm.
because by 18 months, most children are speaking, right? They're saying many, many words.
Mm-hmm.
And so if you notice certain behaviors in your child that's unusual, like the child, for example, who's always walking on their toes, the child's always flapping their arms, the child doesn't have eye contact, who's not interested in the world around them, just their own world, and someone who's not speaking, then of course your medical practitioner, your pediatrician needs to get involved.
Right.
One of the things that we recognize in medicine, in pediatrics, is that early intervention is the key.
Right.
The earlier you intervene and diagnose and treat, the better and faster the outcome. Now, autism is not a death sentence.
No.
It's not good news, but the good news about autism is that if you have the right intervention, you can make a tremendous difference in your child's development.
Mm-hmm.
And so we have many patients who are on the spectrum who, after intervention, their language improves, their social interaction improves, but it's very important to get early intervention. Yeah. If your child is not speaking, we have a rule of thumb by age 2 years, they should be putting words together. My toy, hi mommy, I want milk, that kind of stuff. If your child is only having very few words, particularly if they're not looking at your face when you talk, don't respond to their name, that's another one. You ought to have your child evaluated. Mm-hmm. And we have many specialists in our country. We even have several pediatricians who are trained in the diagnosis and proper documentation of the autism spectrum disorder.
I like how you brought up, speaking. Let's say the child is not autistic, but they take a very long time to speak. What you recommend to anxious parents, especially like me, because I've been through that, but I can't wait to talk about that issue with me. At what age, you said, particularly around 18 months?
18 months to 2 years,
So
for
is
sure.
there like a gauge as to how many words they should have or know by that
some
time?
children, I had a patient who at age 2, I mean like 2 years and 2 days, said to me many years ago, "Hi, Dr. Thomas, my girlfriend's name is Jessica, and I share my lunch with her every day," and I was blown away. So you have to recognize that there's a whole range of development.
Yeah.
There's some children at age 2 who are having conversations and those who are not having conversations.
Right.
But the thing I say to parents is you must see progression. If your child's language development at age 2 is the same as it was at 18 months or 15 months, is a problem.
That's a problem.
If you knew only 2 words at 15 months, but now he knows 10 words at 18 months and 25 at 2 years, if he's progressing, then that's okay. But you have to be concerned and you have to seek early intervention. It's always better to have your child evaluated, and it may just be a hearing issue. I know, for example, at a doctor's hospital, they offer hearing screening to all patients. We do not yet in the Bahamas have universal hearing screening.
Right.
And some babies are born with hearing deficiencies.
Yeah.
And so if you're not hearing clearly, that may impact on the way your language develops.
Yes.
You will speak, but it may not be clear. So you have to distinguish a child who's speaking where it's not clear from a child who's not saying any words.
I love
A
that.
child who's not speaking and needs to be evaluated early.
You brought me back a few years. My daughter, Charlotte, it's something about a mother's intuition, right?
Yes.
She got a checkup. This is before I knew about you.
Yes.
So she was somewhere else. And that particular doctor said, because I was panicking why my child isn't speaking. She was only saying like one word. And that was it. I think she was about 15 months, almost 2, right? And then when she was saying anything, as you said, they were blurry, chawa instead of, for water.
Yes.
What? And so I kept complaining about it. I said, this is not right. Something is not right. Oh, when she gets a little older, she's going to develop. It's okay. This is what, it's not abnormal. This is going to pass. Which is so weird for me. That's another reason why you can't compare your children. Each child is different.
Correct.
All right. Because my son was speaking from 12 months. At his birthday party, he could tell you what he wanted, what he don't want, etc. So it was a challenge for me. All right. And so here it is that I'm trying to figure out, why isn't my child speaking? And if she is saying anything, it's far from what she's hearing, or from what the words mean, or what the word is. And because I did not accept what he was saying, because then it was also suggested that maybe when she goes into preschool, in kindergarten or whatever have you, when she hears the other children speak, maybe her language will be developed, right? And no,
but some of that is true. Some of that is true. If you're at a train station and it's 3:15 and the train should have come at 3, the train may be late in coming, but it may not be coming. So as a pediatrician, though, I learned very early as a young doctor to listen to my parents.
Right.
You disregard your parents to your peril if you're a doctor.
Right.
That's one. And two, it's better to be preemptive. You have to think about, what does language delay mean?
Right.
And it's always better to prevent. It's always better to check and to confirm that your child is actually normal.
Right. Hold on.
Don't
now.
wait.
There's more to the story.
There's more.
So here it is that, he kept brushing me. The doctor kept brushing me off. So I took it upon myself to go to, I don't mind calling her name, Dr. Scrivens at that time. And I explained to her my situation. I told her, she's like, okay, well, you're going to need a doctor's recommendation or something.
Yes.
That particular doctor was not there, but there was another doctor available. And I'm not going to say that person's name, but I went on the phone with the doctor and I said, listen, from a mother to mother, because I know she has a child. I said, I need your help with this.
Mhm.
And da da da. Long story short, she faxed over the whatever
Requisition,
recommendation
yes.
right that was needed. Dr. Scrivens did Charlotte's hearing test. Come to find out, she had fluid in her ears.
Mhm. Yeah. Early
I cried that whole
intervention.
day.
Early intervention is the key.
I cried that whole day.
And my colleagues, we have to all listen to our parents. Very, very important.
And I never went
can't
back
say
to
that-
that doctor,
I can't
by
say
the
that
way.
enough.
And that's why I found you, by the way. But I never went back. And it made me so upset because, you know, I didn't want to talk about, thank God, I didn't want to talk about it. But you have, like you said, you have to listen to the patients. All right. So what would have happened? Because I don't know. What would have happened if the fluid stayed there? What? Well,
it could have caused severe ear infection and can cause damage to your hearing apparatus. I mean, it could extend to a mastoiditis, which is an infection of the bone behind the ear. So many bad things could have happened. But
Anyway,
thankfully, you pursue, you followed your mother's intuition.
Yes. And I get, you know, teary-eyed quickly. We ain't going back there, right? So what else do we need to discuss now? Autism. Can we talk a little bit about that? When we had a parent on the show that spoke about her child with autism, the way that she is grooming her child is just like that child is just an ordinary child, just like with everyone else, blending with everyone else. Of course, there are moments when she has a little outburst or whatever have you.
Yes.
So is there like a certain way a way to I'm trying to form my question appropriately as to not offend. Is there a way that a parent or a mother can bring up a child who is autistic without
Professional intervention?
Right.
What you do at home is very important. And
because a child can thrive in other school environments.
yes,
Right.
it's very important that you do your part. So communicating, reading, take your child to the park, doing normal things with your
Normal
child.
things.
But a child who has autism needs some professional intervention as well to supplement what you're doing at home. They need occupational therapy. They oftentimes need speech therapy. There's something called ABA, Applied Behavior Analysis Therapy, where they're taught how to communicate their needs.
Right.
So they teach your child how to not just pull your arm to the fridge and point, but to say, how to communicate. So yes, what a parent does at home is crucial and will certainly supplement what's done by the professionals. But if your child has autism, they need professional help.
Right.
You cannot do it on your own.
So my question then is, can they go and be in other school environments?
It's called a spectrum for that reason.
Right.
There are some children who are more mild and some who are more severe. So not all children who are autistic need to be in a specialized school. Some of them can be in what we call regular schools, but with particular attention to classroom size and individual attention and so on. Their needs are extraordinary, and it's quite a challenge.
Yeah. All right, Dr. Thomas. My final question is about preschools, and I think there was a texter that asked about that already, but
Yes.
maybe we could speak a little bit about that. I know that in most situations when you're a kid, you realize that you have your child at home all the time, no sneezing, no coughing, none of those things take place. I know the answer because you told me that before, because I thought it was the school. But just for those who may think that the school is nasty or the school don't dust properly or whatever have you, let's talk about how as soon as you take your child out and you put them in the nursery and these things happen.
So in the first few months and years, your child's at home with mom and dad, maybe another sibling, and you have much more control and the level of exposure is limited.
Mm-hmm.
You go to a school where there are 15, 20, 25 kids in the classroom. They're being bombarded by germs, and kids share their germs and share their food and their meals and their toys, and hands go in the mouth and they don't wash their hands as often as they should. So it's expected that your child's going to have more illnesses. Sometimes parents will say, maybe I'll wait till she's 4 or 5 then to send her to school, but the same thing will happen. So be prepared that your child is likely to become more sick after starting school. And I'm glad you raised that point. It's not necessarily the case that the school is unsanitary or
Right.
unclean. It's just the exposure.
Yeah.
It doesn't matter where the school is.
But doesn't that develop the immune system even
It certainly
greater?
contributes to your
Right.
development. You one of the theories that people put forward to explain why we had so many serious illnesses in the last year, their theory is that we all were confined, we all wore masks, we were more meticulous in our hygiene,
Mhm.
and so our immune system was kind of not challenged.
Mhm.
And now we have dropped the mask, people are more relaxed. But the reality is you're going to be bombarded by more germs in school.
Mhm.
It's a reality.
Is there anything?
We
Oh, sorry.
try to impress upon children in our offices the importance of hand washing.
Yes.
In my practice, I'm sure my colleagues do as well. We always wash our hands in the room where we
Mhm.
examine the patient, and we really make a big deal about it.
Yes.
And the kids know, they'll tell you, yes, I should wash my hands before I have my meals and
Yes.
after using the bathroom. So we have to just reinforce good, sound behavior and
Yes.
practices.
Yes.
But even when you do that, your child will get sick.
Yeah.
And of course, you have to make sure your child is vaccinated and is eating healthy. Did we talk about sleep?
No. So
Sleep,
how
is,
many?
ve- sleep is very important.
Of course. How many hours of sleep should
A young child needs 8 to 10 hours as a minimum a night to be fully functional the next day. One, to allow their bodies to repair and heal from the stresses of yesterday. Sleep is very important. We have to make sure we take away devices from our kids who are going to sneak and watch movies at night and play games. But it's very important you have adequate rest.
Yeah, and then you don't want to stimulate them, especially as babies. I know with my kids, like if they're overstimulated, it's going to be difficult for them to even settle down. So, can you talk about how parents should settle, especially with young babies, their kids prior to sending them to bed?
So, develop a routine that works for you.
Yes.
For some, it's a bath. Turn the lights down low. When they're old enough, you can read a story. It's good to have a routine so they get into that routine. So they shower, they have dinner with family, they shower, mom and dad read a story, you tuck them in, spend some time with them. And then that becomes such an ingrained in their daily activity, becomes the norm for them. But certainly not watching television late at night.
No, and then just, or playing like.
You have to kind of wind down,
Yes.
Take it easy.
I had to teach my husband this because when he's coming home is usually the time when they're preparing for their baths and getting settled. And he gets excited. And I don't stop him, but I have a routine for them. For 7:31, if anybody eyes still open, I go in there like a monster. You know what I mean? So let's say he comes home at 7:29 and I'm like, "Urgh," because he gets all excited, which is fine because he hasn't seen them since that morning.
Understood.
And then he would have them all hyped up, and so it would take a longer time for them to settle.
Yeah.
But in that case, it's different because he wants to see his children.
Of course.
But yes, there is a routine. I think Beta, you have a question?
Yes. I have a question.
Sure.
So I heard from some advice from doctor.com.
Yes.
Right.
I hear you're familiar with this work. That with toddlers, and it's so interesting that Trishawn mentioned that when her husband comes home, the kids get all excited. But is there any truth that as toddlers are getting closer to their bedtime, because I've noticed it with my own kids.
Yes.
When I'm talking about that 15-minute interval right before they're about to go to sleep, they get hit with this wave of energy that I'm like, whoa, what's going on? And doctor.com recommend it's good to indulge them in some rough play as a part of their nightly routine before they go to bed, because it somehow gives them the sensory input that they're looking for.
I'm not aware of that. I certainly would not recommend that.
Okay.
I think that's off. No, I mean, children are as varied as you described earlier.
Yeah.
Some of them will just go straight to sleep. Some want to play, but I think it's best to kind of wind down, turn it down, the activity down. So I don't recommend that rough playing.
Hey, anybody else too?
No.
Doctor.com gets it right sometimes, but it's best to listen to the experts. Listen to your doctor.
But listen, for those who are listening and tuning in, anybody else, children somehow always thirsty when it's bedtime. Like they always trying to find an excuse. I want some water. You just had water, but 10 minutes ago. What you what? Oh, my eye. Oh, my hair. This and that or whatever. So they make
Yeah,
every excuse
know.
whatsoever.
I know.
So what I did was I flipped the script on them, and so at about 7:25, after they have already had their baths and I'm settled, this is your water. You drink some water now. You have a temperature. You okay? Yeah, I'm gonna check you. So you have absolutely no reason to come and let you use the restroom and then go to your bed. You settle. So I've had this routine with them since they were babies. I read to them every single, even in the womb. You know, I've been reading to my children. That's something that they do now. Like, mommy, can I read to you? Yes, you can. Yeah. You know, so routine is important.
It's important. Trish, we're coming towards the end. It sounds like have we talked about discipline yet? Discipline.
Ooh, dun dun dun. Now
it's maybe a whole show.
Let's cover that because we got 10 minutes, so we're gonna cover a little bit of discipline. And this is strange because you do have some parents who don't believe in that. You have some parents who would allow their children to do whatever they want to do. And then, we have people who are a little bit closer to our skin color that knows what it takes to, little whipping wouldn't hurt you. Let's hear what the doctor has to say.
Let's talk about that. I mean,
discipline.
The first thing is discipline has to start early.
Yeah.
Children will always push the boundaries. That's their job. And so we have to have, when we say discipline, we don't mean pain and anger and so on. We mean this is the way I want my child to develop.
Right.
So discipline can impact even bedtime.
Yeah.
In our house, we don't throw things in the living room, whatever. Right. And so you have to be consistent. A child will always seek a second opinion. If mommy says no, I'm going to check daddy for a second opinion. And so as parents, you have to try to be on the same page.
Yes.
If your child is 2 years old and they slap you in the face, don't laugh. Say no.
Thank you about that.
No. Yeah, you have to be, and children look at your face and they can read your expressions. So I believe in discipline. I don't necessarily believe in spanking. I think people who spank are often that angry and react. I think it's better to have other forms of discipline where you have a conversation, one, and you take away certain privileges. Right. Those work. You want to teach your children habits that they will carry into their adulthood.
Right.
If you, as a young mother, every time you're naughty, your mother spanked you, you think that's a normal thing, right? So, I mean, are there some kids that need a little tap on the hand, say, don't touch your iron?
Right.
Probably. But most people spank are angry and out of control.
Yeah.
I think the key thing is to understand discipline. I've even heard people quote the scripture about sparing the rod. And I don't think God is interested in inflicting pain on our children, but he still wants them to be disciplined.
Right.
And so we have to be very firm, lovingly firm is what I call it, with our children. And it starts early. You have about 3 to 5 years to inculcate some good behaviors in your children.
Well, I do a little bit of both. I spank, but I don't spank out of anger. I speak first.
Yes.
And I give them like 3. Yeah, my kids aren't really that bad for me to be spanking them anyway. But if they, when they were younger, I'm not going to tolerate you running up and down in the food store and all those other things. You have to know how to keep, have control, have self-control, even at a young age. So they didn't really get much spanking per se, but they did get a little spanking. And then I would spank them right on their hands or something like that. So I personally believe that spanking is okay once it's not done out of anger, like you said, because you don't want to get so out of control as a parent that they feel as if the kids feel as if it's abuse. Now, as I said in my previous shows, I would have been calling 911 to see 100 times when I was younger because what I used to get back then is what they would call abuse now. But
so you were naughty.
I was naughty. I'm not going to deny that. But anyway, that's for another topic. But yeah, discipline is good. And then, just taking things, confiscating things that they desire, that they want, that their devices or, no, you can't watch this particular, you can't watch TV or something that that if they do it again or they won't do it again because they know what would have happened, before or previously. And like I said, when we discipline, we explain why we're disciplining our kids.
And a little bit about, I mean, we have to be mindful about what our children watch and listen to.
Oh, yes. Absolutely.
We have to be mindful.
Yes.
That goes in the brain and it's not easy to come out. So
Yes.
we have to be careful. Don't allow our kids to decide what and how much and where and which
Yes.
sites. You have to have parental control. That's
Yes.
very, very important.
Yes. And so outside of outside of all of the, the physical part of you seeing your patients, just I guess this comes under mental. Have you had any children that you knew would have needed some intervention outside of what it is that you do?
Yes. And I always refer. I mean, depression, we see that sometimes. We don't see a lot of mental, at least I don't see a lot of mental disorders. I see more psychological issues.
Yeah.
So behavioral issues, severe temper tantrums,
Yeah.
children acting out at school. And so when our kids come to us, they bring their school report cards, we discuss those things. And they look forward to showing off their good grades. But that's also an opportunity to encourage those who are not doing so well.
Yes.
When you asked about mental health, I had a thought which I have to bring up before we close.
Sure.
It's very, very important as parents and guardians that we deposit positive energy into our children.
Yes.
We have to say wonderful things, good things. They have to hear it all the time.
Affirmations.
Affirmation. They have to know that they're loved, that they're special, that mommy loves them. We have to create a safe space so they feel comfortable to come home and say, mommy, A, B, C, D happens.
Wow.
If your child knows that you're going to row and carry on bad, they're not going to share with you.
Yes.
So my mother used to say, don't ever lie to me. If you tell the truth, I might spank you, but if I find you're lying, you're in trouble.
Mm-hmm.
But it's important to create a safe space where our children feel comfortable to share.
Yeah.
And my wife does it very well, better than I do. She'll ask, tell me about your day. Not just how was your day, but tell me what happened to school today.
Yeah.
And so we have to spend time in the evenings talking to our children, especially the younger ones, so we can know what's happening in their lives, how they're feeling.
Yeah. Absolutely.
We have to keep checking.
Absolutely. And on that note, in fact, just before I do that, because I have my talk to the audience moment, I want you to share, Dr. Thomas, how persons can reach you. And should they have questions, should they need or looking for a pediatrician, those who may be pregnant and looking for someone to reach out to, I highly recommend him. I am very particular, and I can tell you, I've done my research, and that's how I got with him. 3 of my beautiful, wonderful children are patients of Dr. Carlos Thomas. All right. Hello. Okay. Is that a question, Beats?
Well, let me respond. We have over 30 plus pediatricians in the Bahamas.
Mm-hmm.
I'm happy to say I moved to the Bahamas 32 years ago because the Bahamas needed 16 interns to run Princess Margaret, but there were only 2 Bahamians in training. So I was one of 14 who came here. The pendulum has swung. We now train a lot of Bahamians, which is wonderful. And there are lots of well-trained pediatricians. When you get to our level, it's not who's better, who's worse. I mean, it's a matter of
what works for you and your family.
What works for you. It's like flavor ice cream. Some people like butter pecan, some like chocolate. So you find a doctor that you feel comfortable with, that you can relate to, and that's your pediatrician.
Yeah.
To answer your question, my office is on Collins Avenue. The number there is 325-8028, 325-8028, and also at Case Village, 327-7790.
Okay. Thank you, sir. And I think you answered this, but let's see if you may have another way to answer this question. It says, how do I discipline my soon-to-be 2-year-old who is still understanding right from wrong, but I feel is too young for spanking?
Yes. So everybody in the household has to be on the same page.
Right.
You have to be firm. Your no's have to be no. And children listen to your words and also look at your mannerism and your facial expression. You can't be smiling when you say no. You have to be very firm and just be consistent, be lovingly firm. Do not touch that.
Right.
And if you do it repetitively, it becomes part of their psyche. So don't give up. It's a child's almost responsibility, expectation to challenge you, to push the boundaries. But as a parent, we have a responsibility to control the way our children behave by, first of all, modeling good behavior in front of them.
Yes.
I can't say that often enough. And then be firm as we express our love to them.
Yes. And is there a thing? There's such a thing as terrible twos? Is there really a thing as terrible twos?
There is a thing as terrible twos. I mean, at that age, children are aware that they exist. They're aware that they have not rights, but they want their own to express themselves.
Yes.
So what we call terrible is a child wanting to express themselves and do something, and that is opposed to your idea.
Mm-hmm.
So they're trying to find themselves. So it's terrible twos, terrible threes, terrible fours, and at every age, your child will challenge you.
Yes.
You have a soon-to-be teenager, right? So you're
Yeah.
going to find out soon when those hormones start flowing.
Ooh,
So you have to learn how to adjust and adapt as
to them.
parents.
Yeah,
What worked at age 5 may not work at age 10.
that's good.
If you if you think about spanking your teenager, you have missed the boat.
Exactly.
You have missed the boat. You have 3 to 5 years tops to instill and inculcate some good habits in your children.
I like that. All right, so we're gonna do our talk to the audience moment, and this is brought to you by Your Lane Life Coaching. And talk to the audience moment is just something that I information on nuggets that I put together prior to the show, depending on the topic. And most of the things that I say on here are things that our guests would have already mentioned, but because it was done prior to the show, then of course I'll just reiterate what is said. And the first thing that I said here is that you need to get your children check up annually, even if they seem to be okay or they look healthy. Some go and get blood works done. That's important because, as you said, preventative measures are better than you just waiting at the last minute and then you realize that this is something that could have been detected, even if you just went and do your annual checkups. Yeah,
Strongly agree.
Strongly, right. So that same illness could have been discovered had you done an annual checkup. My second point is we want to focus on our children's diet with intentionality. We give them foods and the same foods that are some of the bloodline illnesses in our families. All right. The hypertension, the diabetes, obesity, yet we are feeding them whatever we want to now. And just as Dr. Thomas said, if you start early with the nutritious meals and healthy eating and lifestyle instead of going to fast food places all the time, you find that it'll be easier for them as they transition to eat a healthy to have healthy alternatives, and then perhaps prevent the bloodline diseases and illnesses that may be in your family line. All right. The third point is, or at least manage it. The third point is manage your child's health is not necessarily just physical. It is also spiritual. It is mental. It is emotional and social, and everything that helps allow your child to be holistic. My question to you is, what area do you think you need to work on more with your child? Remember, there's the physical, the spiritual, the mental, emotional, and social. And I challenge you to go ahead and be more intentional about working on that area. That may be at the weakest, whichever one. All right. Sometimes the child is reaching out to you for just time, quality time. Sometimes it would require you to spend more time with them, to read books with them, to help with their whatever growth and development, emotional, because that's emotional, right? Sometimes it would require affirmations to help them. They may be getting teased at school or in their neighborhoods or whatever have you, even from their own siblings. All right. It is your job as a parent to ensure that these children are healthy, not just, once again, not just physical, but in all aspects of their health for a greater development and a holistic child. Right. All right, so go ahead and do that. Go ahead and spend some time. And as Dr. Thomas alluded, it is good to ask questions. And this is something that I do with my children as well. When they come home from school, I want to know, who did they play with? Who did you play with today? What did the teacher say today? What was your challenging moments at school today? These are questions I've been asking from since they were in preschool, and that gives way for conversation. So I'm able to feel out if something is not right.
Mhm.
Okay. If something maybe, there are no bullies at our school, thank God, where they attend, but you can find out if your child is being bullied by simply just asking, just having a conversation with them, so they'd be able to sometimes not even directly tell you, but you could pick up that something is not right. All right. So these are things. So you need to pay more attention to your children. Even at, and we spoke mostly about babies and toddlers. We didn't get into the preteens and such, but they need our care more than anything else. We can't just leave them out with their devices and think that they're okay. It's good to just go in their room sometimes and have a conversation with them. Ask them some challenging questions. Ask them questions about life. Get to hear their views, because even as they grow and develop, they change. You think that they're still the little 5-year-old boy and a 5-year-old girl that you once had when you were paying attention. Don't allow your work, your ministry, especially with those who attend church and stuff like that, to be more for you. Don't spend so much time at work and in ministries and doing everything else, and you're limiting your time with your children. The older they get, the more they need you. You may think, okay, I'm going to back up now because they're more independent, but this is the time that they need for you to speak to them and speak words of wisdom and life into them. Don't neglect your children. Don't neglect them. My fourth time is to schedule some me time for us as women who are listening. Of course, we have some men listening as well. You are no good to your children if you are burnt out. That's very, very important. You want to show up for them and pour out your parenting skills. But if you keep going and going, then you have no energy. You're going to end up so depleted that you can't function to keep them physically or mentally or spiritually healthy. So allocate some time. I don't know, ask grandma, ask a neighbor, someone who's responsible, of course, and who you trust, even if it's just 1 hour, to just keep them. Someone you could trust and is responsible, of course. I have to reiterate that. And just spend an hour just for you, even if it's just to go on the beach or just to read a book or just take a warm bath without someone. Because I know how it is when you want to have me time and you're in the bathroom and you hear this, Mommy! Like, can I have a break? Yes, you're going to need a break because it could be so exhausting. All right. But you're doing an awesome job as a mommy, as a parent. Keep on doing what you're doing. I know sometimes it can be difficult. Sometimes it could be weary, especially for single moms out there. Keep on going, because you're not just living for them. You're not just living for you. You're living for them as well. All right. And so I'm going to close out on that. And I want to let you know that for any life coaching or marital coaching that you may need, you can go ahead to Your Lane Life Coaching, where of course, I'm a life and marriage coach. The website is www.yourlanelifecoaching.com, and you can go on there and schedule a consultation. I would be happy to assist you in whatever difficulty, or maybe just wanting to know how you want to thrive or move ahead in life. I'm happy to go ahead and help you out on that. So as we wrap up, Dr. Thomas, do you have any closing words for us?
I've thoroughly enjoyed our time together.
Yes.
Thank you for the opportunity. Our children are our biggest assets in the nation. They're our future.
Yes.
We have a responsibility, a God-given responsibility, to look after them,
Yes.
to make sure they are on firm footing, that their foundation is strong.
Yes.
And that means their physical, as you said, mental, psychological, spiritual health is intact.
Yes.
So we can do our part. It's our responsibility. Our number one responsibility is to make sure we produce healthy young people.
Absolutely. Thank you so much. Thank you for your insight. Wasn't today's show just a hit? It was wonderful. I love it. Thank you so much. Thank you, Dr. Thomas,
My
for
pleasure.
your presence and your time. You should see me praying that no one have any babies today, because the doc would have to go and leave me. And so for the mommies, expected mommies, thank you for holding up the fort for us in this time that we spent here. May God continue to bless you and throughout your pregnancy. So today's show was brought to you by Airborne Freight and Cargo Services, John Shoe Store and Accessories, Your Lane Life Coaching, Bahama Odds and Ends Party Supplies, Listerine, distributed by Lowe's Wholesale, The Perfume Bar, and Dairy Queen. Next week's show, we will have with us Dr. Maggie Bain. She is an intimacy and relationship specialist under the topic, Help, I think we've disconnected. Of course, this is a show for everyone that is in a relationship, but particularly those who are feeling disconnected with their partner for whatever reason. It could be because of, the job is in the way, the kids are in the way, always fighting or having disputes because of finances. Whatever the issue is, Dr. Bain is coming in studio next week, God's willing, so that she can hear, so she can give some tips as to how we can help build our intimacy and our relationship with our spouses. All right. So you want to tune in for that. Thank you to my producer, Beats. You've been holding it down. I see the little clips and stuff you've been placing on there. Thank you so much. Thank you. Thank you. Thank you. Thank you to my Facebook audience. Y'all are always on point. Our continued listening audience and our first time listeners, thank you so much for tuning in to Your Lane Talk Show. And I pray that you were all empowered, all educated, and all encouraged today. Until next time, happy Sunday.
To Your Lane with Coach Trish Hanna.
George Shoes and Accessories is your one-stop shop for